Alright, so I wanted to talk to you guys today about ECOG. I have practices that actually have evoked potential equipment, and they do more ECOGs, and now VEMPs as well, than they do ABRs. I have some practices who've never done an ABR. All they've ever done is ECOGs with it. And maybe we'll see the reasons why. So this is not something new. See, these two studies are from way back in 1930 even. Well, why would a doctor order it to begin with? Well, because, here's the answer, he wants an objective confirmation that the patient has what he suspects they have, Meniere's disease or lymphatic hydrops. And basically, see, this is a cochlear microphonic that you would get from condensation or rarefaction. Alternating cancels that out, and you have a true summing potential. And sometimes the summing potential is a nice discrete wave just before the action potential. In this case, it's just a little bump on the leading edge of the action potential. And so you're probably saying, Greg, could you flip that around and make it look normal for me? Okay. So this is the way most audiologists in the United States display their ECOGs. All you have to do is hit invert or switch the electrodes around. The montage I gave you was for a positive going action. Realize that the generator of this response is the cochlea. Okay? And no matter how we collect this response, it's going to be a far field response. In other words, our electrodes are far away from the generator of the response. And this response, especially the summing potential, this is the smallest measurable potential that the human body produces. We want it to be near field, but the only way we would make it, this is probably the best slide in your handout. The action potential is the thing to find first. That needs to be obvious, where I wonder if it's there or not. Well, if you have to wonder, it's not there. It should be obvious. You'll find it first and mark it. It'll mark AP on the equipment when it's set up for ECOG, and it'll be around 1.5 milliseconds, just where you expect it.